At Brighton Podiatry, we've been using lasers to treat onychomycosis for 2 years now. So, what is onychomycosis? And how do we catch it? Onychomycosis is the medical name for toenail fungus. It is impossible to say how each individual catches the disease, but the most common ways are use of communal showers, and care should be taken and thongs should be worn to minimise the risk of this infection. One of the most common ways we see young women get this disease is by using nail bars. Beware, the vast majority of these use no form of sterilisation. So what does toenail fungus look like? Well, firstly, there are many organisms that cause this condition, so it can manifest differently from patient to patient. Generally, a yellowish to white change in nail colour can be indicative of toenail fungus. If you notice these changes, you should consult your podiatrist. So, we will show you some examples of toenail fungus. This is a picture that shows superficial white onychomycosis to the second toe. This again shows superficial white onychomycosis infections of several toes. This nail shows toenail fungus that is more a yellowish colour. At the moment it has only infected one side of the nail. This nail shows thickening and the nail is starting to break apart. This nail shows a thickened nail again with a yellow toenail fungus within the nail. Treatment. In the past we have tried topical preparations on the nail, but unfortunately they have had very little effect on toenail fungus. Oral treatments. These have been shown to work in some cases. We see a cure rate of approximately 40%, but they have serious side effects. They are toxic to the liver. Treatment with laser. Laser is the latest form of treatment available. It has no side effects, and clinical studies place its effectiveness at between 80 to 88%. The laser destroys the toenail fungus and the spores that cause the fungus within the nail matrix. The nail then continues to grow out normally, and the discoloration caused by the fungus simply grows out, leaving a nice clear nail. Results. These are a few results that were randomly picked out. Before treatment, and just before the nail had completely grown out, you can see that the fungus has cleared up within the nail. This again shows superficial white onychomycosis, and this is around 9 months after treatment. This nail shows onychomycosis on one side of the nail, and 3 months later you can see that the nail is actually starting to grow out. This should continue to grow out until the nail is totally clear of fungus. Before treatment, the nail had been severely cut back and it was not attached to the nail bed. After 6 months, it had reattached to the nail bed and looked a lot clearer. Conclusion. The right laser used by a competent operator has a very high chance of curing toenail fungus. At Brighton Podiatry, we've been treating toenail fungus for over 2 years. We have had a great success rate. For an appointment to see if laser can help you, please call the clinic on 9592 9000. Thank you.